At the time of diagnosis of chronic myeloid leukemia, it's important to obtain metaphase chromosomes, FISH analysis, and PCR analysis on your patient. And the reason for this is at the time of the greatest disease burden, these tests will tell you something about the disease and how you'll be able to monitor the patient. So one of the ways that you can avoid mistakes in the management of your patients is to understand if the metaphase chromosomes, FISH, and PCR values are reliable in your specific patient. There are often, there's a low percentage of patients who will have false negatives on any one of these tests that may make it difficult to follow patients afterwards. But if you've done that at baseline, then it should be relatively easy to do the tests for following these patients. In fact, NCCN guidelines recommends that every 3 months that a peripheral blood be sampled for PCR analysis. I think the most difficult part of that recommendation, however, is that the milestones that we're looking for at 3 months and at 12 months of a 1 log reduction in BCR-ABL at 3 months and a major molecular response or 3 log reduction at 12 months relies on the international scale. And so it's very important that your institution, your clinical practice, sends this sample to a laboratory that employs the international scale so that you can get data which will be helpful to you in managing your patient. I still believe that achievement of a partial cytogenetic response by 12 months and a complete cytogenetic response by 18 months are the most important and reliable landmarks or milestones for ensuring that your patient is going to have a better progression-free survival. If the patient achieves a major molecular response, that's great. However, remember, if a patient has a molecular response of only 100-fold reduced compared to a major molecular response of 1,000-fold, the outcomes are not much different in terms of progression-free or overall survival in those two groups of patients. And so it's important to use the peripheral blood PCR for monitoring when your patient gets into a cytogenetic response, but remember that it must be done on the international scale. And if it is not, then the NCCN guidelines recommends that bone marrow biopsies are done for metaphase chromosome analysis.